we've all done it right. Reaching for that top shelf, maybe swinging a tennis racket a little too enthusiastically, and suddenly, ouch, that twinge in the shoulder that makes you stop and go, that wasn't there before.
Yeah, those shoulders of ours, they sure do take a beating sometimes.
Exactly. And while most aches and pains fade away, sometimes they decide to stick around, becoming a real pain in the, well, shoulder.
And that's what we're diving into today.
Frozen shoulder.
A surprisingly common condition.
That often gets brushed off as just a sore shoulder.
Until it's not.
So today, we're arming you with the knowledge to understand what's going on, how to prevent it, and what to do if you're dealing with it right now.
Because let me tell you, once that shoulder freezes up, it can be a long road to recovery.
Okay, so let's break it down. For those who might not be familiar, what exactly are we talking about when we say frozen shoulder?
So picture this.
Yeah.
Your shoulder joint, it's this beautifully designed ball and socket joint, right?
Right.
And surrounding that joint is this capsule of tissue, kind of like a little, I don't know, like a little flexible sleeve.
Okay, I'm picturing it.
And that capsule, it's filled with fluid. It's supposed to allow for smooth, easy movement.
All that arm swinging, overhead reaching goodness.
Exactly.
Yeah.
But with frozen shoulder, that capsule gets inflamed.
Oh, yeah.
It starts to thicken. And it can even develop these sticky, fibrous bands of tissue called adhesions.
Adhesions. That doesn't sound good.
It's not. It's like trying to move around with, like, I don't know, have you ever tried to open a window that's been painted shut?
Ugh, the worst.
It's that kind of stuck. Your range of motion, it just goes kaput.
And it doesn't happen overnight, right? There's like stages to this whole freezing process.
Right. Think of it as, oh, I don't know, a slow motion train wreck in 3 stages.
Okay, paint me a picture. What's stage 1?
Stage 1 is all about the freezing. This is when the pain starts to creep in. Gradually at first, maybe you notice it more when you move your arm a certain way.
So you can still kind of function, but it's nagging at you.
Exactly. And this stage, it can last, get this, anywhere from 6 weeks to 9 months.
9 months? Are you serious? So people probably think, oh, it's just a sore shoulder, it'll go away, and they just keep pushing through it.
Which brings us to stage 2, the frozen stage. And here's the tricky part. The pain might actually start to lessen during this stage.
So you think you're getting better?
You think you're in the clear. But here's the catch. Your shoulder is actually more restricted than ever. That range of motion, forget about it. You're stuck.
Stuck for how long?
Another 4 to 6 months, typically.
This is starting to sound less like a frozen shoulder and more like a frozen nightmare.
And just when you think it can't get any worse, you enter the final stage, thawing.
Okay, so things finally start to loosen up.
They do, eventually. But it's a very, very gradual process. Think, 6 months to 2 years.
2 years.
We're not talking about a quick fix here.
Right.
This is why understanding that timeline, knowing what you're in for, is so important.
2 years to thaw out a frozen shoulder. That's wild. It makes you wonder, why does this even happen in the first place? Is it just bad luck, or are there things that make someone more prone to getting frozen shoulder?
Well, some of it is definitely genetic predisposition, things you can't control.
Yeah.
But there are some risk factors that we do know about.
Like what? Give us the rundown.
So folks with diabetes, they're actually more likely to develop frozen shoulder.
Really? I had no idea there was a connection there.
Yep. And thyroid issues too, like an underactive thyroid, seems to increase the risk.
Interesting. So things that mess with your hormones and metabolism can play a role. What else?
Heart disease is another one.
Wow. Okay. So if you've got a history of those kinds of health issues, it's even more important to be aware of this whole frozen shoulder thing.
Exactly. Now, here's where it gets interesting, and this kind of blew my mind when I first learned about it. Old injuries.
Old injuries. Like how old are we talking? Because I've definitely racked up a few over the years.
We're talking anything from a recent sprained ankle to a broken wrist you had years ago.
Wait, you're saying that something like that could increase my risk of getting a frozen shoulder down the line?
It's all about how our bodies compensate. Think about it. When you injure yourself, you naturally start to favor the other side, right?
Right.
Maybe you change the way you walk or the way you reach for things. You might not even realize you're doing it.
Subconscious adjustments.
Exactly. But those little changes, over time, they can put stress on other parts of your body, including your shoulder.
So it's like a domino effect. One injury leads to these subtle shifts in how you move, and bam, down the road, your shoulder says, nope, not doing this anymore.
Precisely. And then inflammation sets in, those adhesions start to form, and before you know it, you've got a frozen shoulder.
Okay, this is kind of blowing my mind. It makes you rethink all those times you just pushed through an injury and didn't really prioritize rehab.
Right. It's a good reminder to listen to your body, take care of those injuries properly, and make sure you're addressing any lingering pain or stiffness.
So, what can we do? Let's talk about prevention and those early interventions that can hopefully save us from a 2-year thawing process.
Well, the good news is that there are some simple yet effective things you can do at home.
Okay, give us the tools to fight back against frozen shoulder. What's on the list?
Stretching. And I'm not talking about just any old stretches. We want targeted movements that gently work that shoulder joint.
So, what, like some arm circles, maybe a little crossbody action?
Exactly.
Right.
Pendulum swings are great too. Just let your arm dangle and swing it back and forth like, I don't know, like a pendulum.
I can picture it. Nice and easy.
The key is to keep that shoulder moving, but in a gentle, controlled way.
Got it. What about heat and cold therapy? I feel like those are always go-tos for aches and pains.
They can be really helpful. Think of heat as your pre-workout warm-up for your shoulder. Applying a heating pad or taking a warm shower before you stretch can help loosen up those muscles and get the blood flowing.
Okay, like pre-gaming for your shoulder workout.
Exactly. And then ice is your post-workout recovery. It helps reduce any inflammation and numb the pain after you've done your stretches.
So it's like a 1-2 punch for shoulder health.
Exactly. Now, this next one might seem obvious, but it's amazing how often we overlook it. Good posture.
Oh, come on, good posture. That's like telling me to eat my vegetables. I know it's important, but
But you'd rather have the ice cream, right?
maybe just a little scoop. But okay, good posture. I'm listening. Why is it so crucial, especially when it comes to our shoulders?
Think about it. How many hours a day do you spend hunched over a computer, scrolling on your phone, or driving in a car?
A lot. Probably more than I'd like to admit.
All of that slouching and hunching, it puts a tremendous amount of stress on your shoulders and upper back.
Because everything's out of alignment.
Exactly.
Yeah.
And that constant strain, it's a recipe for stiffness, pain, and you guessed it, frozen shoulder.
So good posture isn't just about looking better. It's about protecting your shoulder health in the long run.
You got it. Now, all of this is great for prevention and early intervention. But what happens when those home remedies just aren't cutting it?
Yeah, when do you know it's time to call in the professionals? So we've covered a lot of ground here, but let's talk about those situations where it's like, okay, my shoulder's not happy, those home remedies are helping a bit, but I think I need to bring in the professionals. What's next?
Well, that's where a good physical therapist can really make a difference.
Okay, physical therapy makes sense, but there are a lot of PTs out there. What should we be looking for, especially for a frozen shoulder?
You want someone who specializes in shoulder injuries, someone who really understands the mechanics of the joint and knows the specific exercises that can help you regain that range of motion.
So it's worth doing your research, asking around for recommendations, making sure you're seeing someone who's really an expert in shells.
Absolutely. Now, in some cases, your doctor might recommend something a little stronger, like a cortisone injection.
Okay, those are the ones that go right into the joint. I'll be honest, needles and joints, not my favorite combination.
Yeah, I hear you. A lot of people get a little squeamish about that. And to be honest, it can be a little uncomfortable, but it can be very effective at reducing inflammation and providing some pain relief.
So a little short-term ouch for a potential long-term gain.
Exactly. But any decision about injections should always be made in consultation with your doctor. They'll help you weigh the risks and benefits based on your individual situation.
Makes sense. The sources you shared mentioned something called a hydrodilatation too. What is that exactly?
So that's a procedure where they inject sterile fluid into the joint capsule to help stretch it out. It's been shown to be really helpful for some people, especially in terms of improving mobility.
Interesting. I guess what all of this really highlights is that early intervention is key, right? The sooner you address it, the better.
100%. It's like anything else, the earlier you catch it, the easier it is to treat.
So don't just tough it out, hoping it'll magically disappear on its own.
Exactly. Listen to your body. If you're experiencing shoulder pain, don't ignore it. Address it head on. Try those home remedies we talked about, and if those aren't doing the trick, don't hesitate to reach out to a healthcare professional.
This has been a fascinating deep dive into a topic that I think a lot of people probably don't take seriously enough until it's too late.
It's easy to take our shoulders for granted until they stop working the way they should.
So true. Big takeaways for me. Understanding those stages, the importance of good posture, and not being afraid to call in the professionals if you need them.
And don't forget about those old injuries.
Oh, right. Who knew that something that happened years ago could come back to haunt your shoulder?
Our bodies are full of surprises, aren't they?
They sure are. Well, this has been incredibly informative. Thanks for joining us on this deep dive into the surprisingly complex world of frozen shoulder. And listeners, remember, knowledge is power. We'll catch you next time.